The pelvis competency is a framework, okay? So for us to organize our interventions, okay? So, I mean, like we always use SOP. Why SOP is so powerful? Because you have these acronyms in my mind. You know what you are missing. Is it an analysis you are missing, or is it like intervention you are missing, okay? So the pelvis competency is within the I component, okay? That's reflect all the key component of the pelvic physiotherapy to manage a patient. That include pelvic floor rehabilitation, that's a P, and E is education component, L is the load management component. We tend to not do enough in the clinic, and then we have V, we call the voiding V, yes, that's voiding retraining, and I is integrated care, and then we have the S is self-management. So when I have a patient come in, and I need to think about all this pelvis competency, so which is I have done enough, which is I'm not done enough, and that's helped me to structure my I component. And also like that's if the patient is not progressing as what expected, I will have to think about what's the next step in terms of the intervention I'm not doing enough. So that's helped me in my clinical practice. For example, when the patient have been trained so much therapists, and you know you can easily classify different therapy in terms of what is a pelvis competency. For example, if you give a pelvic floor relaxation exercise, that's falling into the path, the P component. And if you do dry needling or the other TENS, that's probably in the integrated care component. Or you do psychosocial consultant, sexual consultant, that's going to be in the integrated care component. So when patients have been trying so much things, I can easily tell, oh, the patient already tried enough pelvic floor rehabilitation, but what I think is lacking is a load management component. So I can focus on the load management, which is probably, that's why the patient meet a plateau. And also, if I have doing enough, if the patient is not getting better, is it a self, management component is not doing enough. So this is, sometimes I will write these letters in front of my patient, tell them this is what you need to do, and this is exercise help to rehab your pelvic floor. This is a treatment we are doing, for your self-management. This is for load management, why it's important to preventing the relapse. So I will sometimes using this to tell my patient what I have been tried, what I want to do the next step, so help me to communicate with my patient.